Hey guys, I'm here with Dr. Katie. Dr. Katie is a chiropractor who has her own practice down in San Diego. And gosh, we got introduced through, I don't even remember. I think we met at
Instagram rabbit hole.
workouts kind of in San Diego in Hillcrest. And I don't know, just kind of weaving in and out through the Instagram channels. I've kept in touch and just wanted to connect and introduce everyone to you and what it is you do and at Family Connection Chiropractic and how you're supporting women through pregnancy and babies in pediatric chiropractic care, which I'm really excited to learn a little bit more about. So I thought maybe you could just kind of give us a brief, like just a little background, how you got into chiropractic, like how you wound up in San Diego, or I know Hillcrest is has a special place in your heart. So I thought maybe you could just tell us a little bit about yourself.
Sure, I would love to. Thanks so much for having me. I love how Instagram miraculously brings people together. So I always love connecting with birth workers, people that support pregnant postpartum people. So yeah, I thank you again for creating this opportunity. I got into chiropractic. I was a college athlete. I played college sports and then went into coaching and moved around. Coaching is a very transient profession. I moved 3 cities in 4 years. And, you know, I'm grateful for that experience because I got really clear on my values of what I wanted out of my job and life's work. And I grew up going to a school with a family, both parents are chiropractors, their kids are all chiropractors. And I always, you know, had a lot of questions around what chiropractic was. Their kids got adjusted from a young age. I would see it in the office, what have you. And I just kept coming back to this idea of service and connection of others, which I identified as my highest values. And then moving forward, I was able to you know, transform that into going to chiropractic school, which I'm super grateful for. I actually don't really specialize in athletes. I think a lot of that process sometimes, you know, gets translated to athletes, but I actually specialize in pediatrics and pregnancy and families. In school, you can choose to specialize in something. Just like medical doctors, you can just specialize in the heart, lungs. I chose kids in pregnancy. Just means I have some extra training in that. It doesn't mean I don't take care of adults. It just means the office looks a little bit more like a daycare by design. So that's me. That's kind of the journey. I'm lucky in the practice that we have a lot of families. We support people during pregnancy and postpartum, but then also their children, and either from a toddler or young age or a newborn, right when they're born, often get adjusted in the office for various reasons, and I'm sure we'll go into all that.
Yeah, I'm taking a few notes on what you're saying. Out of curiosity, what cities did you live in when you were coaching basketball?
I lived in Denver was my first coaching job. Then I moved to Ithaca, New York at Cornell. And then my last coaching job was at Stanford in Palo Alto. And then at that point, you know, in the basketball world, I was working at a women's basketball program we were, I think, top 5 in the country that year. We were number 1 at one point. And I was intern video on the staff, and I was like at the perennial, like I was at a great program, and I was like, I'm still not happy. Great experience, but just knew I needed to switch. I just moved across the bay and started going to chiropractic school in Hayward. So it was great.
That's awesome. Yeah. Well, as you're saying that, I'm like, wow, those are like D1 programs.
Yeah,
Wow.
it was great.
Very
Yeah,
impressive.
I had a great experience. Yeah, thank you.
Yeah, no, that's awesome. Yeah, it's interesting. And if you don't mind me asking, like at what age you kind of had that epiphany? Just because I know that sometimes, you know, some people sometimes say, oh, it's too late. I can't go back and change my career or change my path. So I'm curious at what point you reached that decision.
I was, I think, 27 when I went to chiropractic school. So you're right. Like some people are like, oh, I'm too old to go to chiropractic school, or I'm too far in my life. I went to school with kids who are people that had that had children while in school. They had 2 kids and they moved to Hayward. And you know what? Like, it's never too late to reinvent yourself or do something you really love, because I think you get one life, you know, and I I'm lucky that I was in a position that I didn't have kids yet, so I could do that a little easier. But I was always so inspired by the people I went to school with that had kids. I'm like, oh my God, if you can do this, like I can do this program. Because it was hard, you know, it was like the hardest thing I've ever done. But I think getting clear with my values and then realizing like coaching wasn't meeting those values and how could I get that it made it really simple and seamless to switch. So.
No, that makes complete sense. I know a PT here in Seattle that actually went to PT school in her early 30s and decided, like, I actually want to be a pelvic floor PT. That's what I want to do. So it is never too late. Just kind of switching gears to like the pregnancy aspect. I know that in my experience being pregnant, I did see a chiropractor, but not necessarily one that specialized in pregnancy. To be honest, I don't even know that I knew at the time that existed. What would you say are considerations for your specialization with pregnancy? Like, what should a pregnant mom be aware of going to a chiropractor to, like, what sort of ways you set up your office differently or kind of handle the appointments that make your experience like a little bit different than just any other chiropractor?
Yeah, great question. So to start, a chiropractor that's Webster certified, it's a specific technique that supports pregnant people and can be used postpartum as well through the ICPA, which is the International Chiropractic Pediatric Association. Webster looks at the sacrum, it looks at round ligament, it looks at psoas, it looks at a lot of different muscles and ligaments that are at play that become very misaligned, or as we say in chiropractic, subluxated during pregnancy and postpartum because of relaxin, that hormone that makes the pelvis and just the body a little bit more loose and more easily misaligned. So someone that A, is certified in Webster, I would highly, highly recommend. And then B, the office, I think energy and vibe is going to be a little bit more kid friendly, maybe a little bit more open. A lot of chiropractic offices has kind of like gone to this like open adjusting style, which creates a little bit more of a community feel. Not that the room or closed adjusting style is wrong, it's just a little bit different, but knowing that it's a space that kids cry and run around and are loud, like that's going to support a family atmosphere and an atmosphere that breeds, pregnancy and then postpartum. And it's very common, chiropractors that take care of pregnant people, they take care of kids as well, because it's just kind of like hand in hand. Also because the Chiropractic Association that does a lot of the extra training, it's a pediatric and pregnancy, it's kind of both. So those are kind of things to start with. And then the ICPA website is a great referral network. I start there. If I don't know someone in a city, I start there, and then I go look at the websites to match people for referrals.
That's a great recommendation, because one of my questions was, how does someone find someone who specializes? So there you go. Also,
I believe it's icpaforkids.com.
Okay.
I'm not,
I'll look that up and make sure that it's in the description for this video. One thing I did have a question on is, whether or not someone finds you early on in their pregnancy or, deep into their third trimester, how long is it, quote unquote, safe for them to continue seeing you? Seeing you? Can they come through their entire pregnancy? Is there a point in which, you stop? What does that look like?
Great question. So I always tell women, I totally hear and understand that sometimes they come in because they're in discomfort, and sometimes they come in, they just say, you know what, I heard this is great for my pregnancy and I want to have, the easiest birth, the most ease in birth possible. To start with that understanding, my goal is to make sure the pelvis is really clear and optimized. The pelvis, so if you're looking at the pelvis from like a head to toe view, it's essentially a bowl, and oftentimes these are the hips, they can become misaligned and shifted. So when that happens, now there's not enough space for baby to line up, and sometimes that leads to more interventions, breech presentation, insert all the things, right? So first off, my goal is not to, pain is subjective, and yes, chiropractic can help with that, but my goal really is to optimize that pelvis so the pregnancy and the birth can be a lot more ease. So I always say I always recommend that women come as soon as possible. I'd much rather have a woman in first trimester than in a third trimester with a breech presentation, and now we're kind of working an uphill battle, mostly because the relaxin goes up as the pregnancy progresses. Most people with care that are not pregnant, their frequency goes down because their body and spine start to hold the adjustment. But in pregnancy, it's sometimes a little opposite because the relaxin goes up and obviously you're growing a baby. So those things, it's a little bit of an opposite conversation. So I recommend as early as possible. And then I see women regularly after birth. I'll be upfront, full disclosure, I believe in regular chiropractic care, not just when you're in pain or discomfort, for the sake of your nervous system and how your body functions, your immune system, how you handle stress. All that's your nervous system, and that's what chiropractic is about. So with moms postpartum, relaxin is still really high at 6 to 8 months postpartum. So your body is going to misalign really easily and subluxate. Breastfeeding challenges, those postures are going to put stress on the body. Not sleeping, that's a stress. Being a new parent, that's a stress. All those things impact our nervous system. So every mom is different. Some moms postpartum I see once a week, sometimes twice, depending on that birth and what happened. And a lot of things can happen in birth that, lead to different recommendations for frequency and such. But just driving home that giving yourself grace as a new mom, as a pregnant person, or as a new parent, give yourself grace. There's no rush in doing it perfectly. It's never going to be perfect because perfect is what it is. It's not really attainable, and you have to do it your way and your version. And I think that's also something I pride myself in, is in our practice holding space for those conversations and supporting new parents and mamas in that process. And sometimes there's a lot of tears, and that's okay. That's part of what I have the honor of doing, and just reassuring a new parent and a new mom that they're doing great. And I do, I'm not a therapist, but I do get shared with a lot, and that's part of our job too in the birth community, is holding that space and creating those conversations to have that grace.
I love that. I've found that in what I do, and just even in my own postpartum experience, having the ability to hold that space, or have that space and hold those conversations, was so important for me. I remember going to pelvic floor PT, and usually you can bring your kiddo along with you. Obviously that's private rooms versus an open setup, but
yeah, of course.
There would be times when I'd be feeding him, or he'd be screaming, and milk and formula would be everywhere. And it was just so stressful as a new mom to even make the appointment. I had to allocate like 2.5 hours just for like a 30-40 minute appointment. And so that's also what I think your setup and kind of the space that you're creating, and why it's so appealing, at least to me, and I imagine to others, as a mom, or even in an early postpartum period. I'm 18 months postpartum, is that life is messy, and you can be messy there, because it's kid friendly. You get it. You can have those conversations. And I think that is in itself, I had, questions about, what makes you different than the other other chiropractors, and that in itself is so valuable. Because I think that moms working with someone like yourself, who truly understands the physiological changes their body is going through, and why chiropractic care is so beneficial. Because I hear a lot, why should I, see a chiropractor? What benefit? It's so hard for me to even get out of the house. But just even the conversation about relaxin, and, that also is dependent, as you said, on how long you're breastfeeding. It can be in your body way longer. And some moms, they do experience like the SPD pain, and like the pubic, all the pain through the pubic symphysis, and SI joint pain on the backside. And there's just so many things that can help. And when you were talking about getting the pelvis in an optimal position, like, it was music to my ears, because with literally,
Yeah.
because with training moms, we talk a lot about body positioning and the alignment of the pelvis, so that our diaphragm and our pelvic floor and everything can kind of function as it should, so we can breathe, so our core can act like it's stable, the central stabilization system it's supposed to be, so we can protect ourselves and have nice strong hips. So when you're talking about just the shifting, I'm like, oh yes.
Yeah, that's huge. I think something else though that comes up a lot that I've noticed too is, you know, for you, you're very passionate and very good at what you do, and in the chiropractic world and the pregnancy, a lot of chiropractors are really passionate about natural birth, and that's great. But the reality is, in the birth community, in the birth world, and I think as women naturally, there can be, how do I say this? A fair amount of judgment around those conversations and topics. And I think I early on had to tell myself and check myself, like, Katie, this is not about you. Like, you don't get to have your judgments. And if a woman comes in and saying, I'm having a planned cesarean, you know, and in history, I'm always like, okay, can you tell me more? Like, I want to know why, if there's like a certain positioning or something going on health wise. And if a woman says like, I just want to, I don't get to really have an opinion, you know, because it's not my birth, it's not my body, it's not my journey. So I think really being a space of like no judgment, because you don't really know this whole story sometimes, and being okay and supportive if a mom doesn't want to breastfeed at all. But also having that balance of empowering them with other options, because sometimes they just don't know. You know, like a lot of women have C-sections and then they have a second kid and they're like, I'm just gonna have a C-section. You know, and I always just say, cool, no judgment. I just want you to know you can have a vaginal birth if you want. If you want providers that do that, I have a great list. I'm here to support you, whatever you need. You know, just because I think some moms and families don't know they have any other option, because they just hear like, oh, you have one C-section, you have them forever.
Yeah.
You know, so I think it's just that balance of empowerment, but also no judgment. And that balance is been a journey for me in phrasing things in the correct way and asking the right questions. So the moms and families and parents feel supported and not judged. Because I think, I'll be honest, in the chiropractic world, it can be judgy sometimes. And that is something I really pride myself on not coming across as, and not being, and really going above and beyond to make sure they feel supported whatever they choose to do.
Yeah, I really respect that. Not only just personally, but language is so important when you're working with moms, especially like in the early postpartum period, if they're just trying, you know, we're just trying to survive. So, you know, just the way you phrase things. And it's interesting because with natural birth, as you mentioned, you know, in some countries, they don't really even use that phrase. It's, you know, birth with epidural, birth without birth, or without epidural, or
it's just birth.
It's just birth. Like,
exactly. Yeah.
You want an epidural? Great. You don't? Yeah. Great. You know, so it's this, I feel like there's this pressure to have a natural birth. And I mean, in my birth plan, I was like, heck no, like, I'm not doing that. Give me the meds. And that was just my, you know, my experience. And you know what? The epidural didn't do too much for me anyway. So, but, you know, language is just so important. And like you said, like some families, you know, moms don't even know a VBAC is an option. Obviously there's a lot of factors there if that's an option for them, but just even providing them with the information. You talked a little bit about birth. I was curious, do you, especially more like in third trimester, do you work with women on different like birthing positions and getting their body in different movements, or like help ease them into movements that would be like for labor? I was just kind of curious on that.
Yeah, no, great question. We'll have some conversations sometimes. I usually, the San Diego Birth Education Center is phenomenal. The hypnobirthing class is great. I've been to it, not as a pregnant person, but as a support person, and just also the woman that runs it has invited me as a provider. Their classes are phenomenal, and they talk a lot about positioning. I usually refer my moms and families to those classes. I really just try to focus on their spine and their body, prepping, like I'm part of their like birth team to like prep them for birth. I have adjusted a few women during birth and labor. So I have sometimes recommended, and it's, you know, recommendations like, hey, try this position, try that, just from, I'm not a doula, but just from some doula friends that I, have known, or just from experiences I've just recommended. And then I'll sometimes, if they don't have a doula, like give the partner some tips after I adjust them for when I leave. So low key a little bit to answer your question, yes, but not like emphatically, like it's not a big focus.
Yeah, no, that makes sense. And one little example I can give you that I honestly learned about in a course, and it was so relevant for me and my labor experience was, we talk a lot about like the spine going through flexion, like a crunch or something like that. But if you think about when you are getting an epidural, how you have to move your spine, you have to kind of curl forward as they, get the needle back there. So even having the ability to move your spine in that way when you are in pain or discomfort, and you have, this big belly in front of you. I heard in a course, like the woman who was getting it, like she could not even maneuver her body that way. So even a simple example like that of just getting your spine in a place where you can move, because in pregnancy, there's a lot that's super tight and really stiff. Even though there's a lot that's loose, there's also a lot that's stiff because it's trying to stabilize. So it's wild.
And also trying to empower the person and the mom, and I mean, a lot of hospitals nowadays, the few in San Diego that some of my moms have home births, some of them have hospital births. Either way is great. It's becoming more common that like normally the birthing position was on your back with your legs up in stirrups. That actually is not very optimal for the pelvis. It's really optimal for the doctor and midwife catching the baby. But one of the best ones is on all fours. So, empowering my mom, like, hey, you have a vision on like birth? Like what, do you know any, it's just more of a conversation. Like you ask me, like, do I teach them? I'll just say, you can be on all fours. They're like, really? I didn't know. And I'm like, yeah, you just tell your, doula to tell the OB, or you tell them, or tell your midwife, because now a lot of hospitals have midwives and such. So just like dropping little things here and there to try to help them, because I know it'll be easier.
Yeah, the lying on back with foot in stirrups is typically like the go-to positioning when you've had an epidural, but it's actually a really bad position for your pelvic floor.
And your sacrum, because it tucks your sacrum and it blocks the area where baby's supposed to come out.
So even if you can't go on all fours, like if it's not feasible with the epidural, even if you can just turn on your side, it just opens things up. I've been learning a little bit more about that actually recently. So just simple tips like that. I'm not a doula myself, or I'm not a doula, but I love learning about birth, and I want to have another kiddo one day. So I'm trying to better prepare myself for whenever that happens.
And having a doula I highly recommend.
I'm definitely doing it the next time around. That is like one learning.
Hospital birth, 100%. Like have a doula. There's just sometimes a lot of things, there's like your version of your birth, and then there's like their version of the birth, so it's nice to have someone in between to support you and your partner, and make sure that, your version, happens as closely as possible, but also someone to translate a little bit. So.
Yeah, I love that. Yeah, doula is definitely something I will have thought about a lot for my next birth. Just to transition, switching away from the mom, I know you do pediatric and newborn adjustments as well. So I thought maybe you could talk a little bit about what happens, for a newborn adjustment, or what that experience is like for mom and for baby, just since I know that might be new to a lot of people.
Sure. So I actually, do you mind if I get my keys? I have a model on my keys.
Yeah, no, go for it.
A little bit easier to explain.
Yeah, no, go for it. I've loved and wanted to learn a little bit more about this myself, because I was also reading in your San Diego Voyager article and on your website just some of the like long-term benefits, like what they've seen, for babies and small children that have been adjusted, and how that pays, I don't want to say pays off, but just sort of the long-term effects of that. So I'll let you take it away.
Sure. So to start, I have this on my key. It's the first bone in the neck atlas. It's not a real one, it's just a keychain. but it's a nice illustration piece. It's actually the top bone of the neck, which is right up here, right underneath the ears and houses the brainstem. It's very commonly subluxated at birth. I believe not 90% of children, 9 out of 10 kids are subluxated when they're born. And again, this can be just a normal birth, no trauma, no nothing. You still have some trauma up here in the upper cervical neck and in the lower back and the sacrum. In addition to the positioning while in utero can put stress on the spine. When babies are born, the spine is very, very delicate and very malleable, very much like Play-Doh. So full disclosure, adjusting an infant is very different than an adult, but those misalignments can have a big impact on neurology and how the brain and body develops. A high percentage, I believe it's 90%, I could be wrong, don't quote me, but of brain input comes from the spine. Because your spine houses down the middle and how your brains develop and grows, it's going to come from how the spine is moving. So that's a big reason why we check children. Birth is a big trauma on the spine, especially upper cervical neck area. And a lot of things like latching, immune system, colic, ear infections, breathing, digestion, all very connected to the spine and often very commonly have challenges when babies are born. Maybe the latch isn't great, colicky, uncomfortableness. And then as they develop, they start to walk and fall. Now that's a little trauma on the spine or the sacrum, and now that sacrum can lead to digestive issues. So that's why I recommend getting children checked from an early age. I've checked a baby a few minutes old. I've checked babies a couple days old. I've checked, kids 3, 4, 5 years old, just to support their spine and nervous system and development through different stages and traumas. So newborn, that's a stressful state for the baby. As the child starts to walk, that also means new things and new challenges. And that's why I check children regularly and I recommend it. As they start to go to daycare, they're around a ton more people, their immune system is gonna be impacted and start to grow. So getting a kid adjusted regularly can support their immune system. There's a lot of different aspects to life that the spine and the functioning of the spine and how the nervous system communicates envelops and supports. So adjusting the spine regularly to allow the body to adapt better and that communication channel to be clear, to adapt through all those stages is super beneficial for kids as they go through life's processes.
That's awesome. That's super informative. It's interesting as you're talking about this, I'm thinking about my son, like, oh, maybe I probably should.
Yeah, 100%. It's nuts, like going to chiropractic school, because chiropractic it's a philosophy on life and health and health. We look at things sometimes a little differently than mainstream. A lot of kids are chiropractors whose parents are chiropractors, and they were all adjusted their whole life. And we get to school and it's this conversation of like, yeah, I was rarely sick. We actually had like get to stay home free days because I never got sick days because I never missed school. I got 1 day a year that I could choose to stay home. Like it's just a different philosophy on health. And I'm not saying they never got sick. It was just really rare.
Yeah, that's
because they just grow up in like a different conversation around health and how health is created. And in chiropractic, a large part of our philosophy is health is created through the nervous system and how the body functions and adapts to life. We want to make sure, the analogy I give is Wi-Fi. We want to make sure the internal Wi-Fi in our systems have 5 bars instead of 1 or 2. And when you have stress, the bars of Wi-Fi go down. We get adjusted to make the bars of Wi-Fi go up.
No, that makes a lot of sense. It's interesting that you were naming a few things, because I'm like, oh, my son, he's 18 months, so he's walking and running all over the place, and he trips and falls all the time. And he has tubes because he had a lot of ear infection issues. And as I'm talking,
I did too as a kid. I wish I was just as a kid. My health would have been so much different, and probably different now as an adult, to be honest.
Yeah, I'm like, oh, I need to call and make an adjustment appointment.
Yeah, I'll find you someone.
When I'm in San Diego. Maybe I'll bring my son in for an adjustment when we come to San Diego. But
I'd love to see you. But I will be upfront. It's the regularity. It's the habit. Just working on exercising. It's like I would love to take care of him when he's here, and I would be honored. But it's the regularity of getting him checked once a month, every couple of weeks, what have you. through
Yeah,
his,
no, definitely. I think it's even just to get
process.
an understanding about the experiences and
Yeah.
how he'd respond. I know you work with a lot of kiddos, and you have, a lot of toys and a lot of distractors there, but I
Yeah.
know how hard
Oh
it is
yeah.
to even change his diaper. So I'm like, oh goodness, how is it going to be to
I
adjust?
mean, you get like some kids, like in the beginning, like I adjust them while they're playing with toys, and sometimes they like hop on the table, and it's just a comfort. Like some kids are just have a lot of energy, so they're not getting on the table, and eventually they see their parent do it, and they're like, oh, okay, So it is a comfort thing. But we adjust kids while a mom is holding them, the dad, or while they're playing. Like you just have to be adaptable when you take care of kids.
That's awesome. No, that makes complete sense.
Yeah.
Wow, I feel like I've learned so much from our conversation. Like,
I'm
God,
glad.
we
That's
went from
great.
Cornell and Stanford basketball to adjusting babies. But I think like
Very
one
different.
last
Yeah.
thing, where can people find you to learn more about you and your services and just you out and
Sure.
about in San Diego?
So my Instagram, Dr. Katie Valadez, Valadez. Oh, I noticed there's a typo in my Zoom. And my new last name. I'm clearly not good at typing it yet. There's actually a ton of videos on there and the highlights of kids, newborns getting adjusted and me talking through it and what that looks like. It's really gentle. It looks about as much pressure as you would touch an eyelid or ripeness of a tomato. It's very subtle. So I always like to have parents look at it to see and be like, oh, it really doesn't look like you're doing anything. And like, yeah, it's not that invasive at all. Our website, familyconnectionchiropractic.com, and then our Instagram, Family Connection Chiro, or at Family Connection Chiro. You can DM me individually if you have questions. You can reach out on the website if you want to call the office and ask questions to my awesome CA Taylor. And I'm always open for consults on the phone or questions on Instagram, because that's how the conversation starts. Sometimes you just have to ask more questions.
Yeah, no, I will also vouch and say that Dr. Katie is super responsive and very forthcoming with just information and any advice that you may need, just so you feel comfortable going into her space, especially now. I know it's crazy times, but I do vouch for chiropractic, and obviously we've learned a lot from you today. So
thank you.
Thank you so much for your time. And I'll make sure that all of your links and some of the resources you mentioned are linked or in the notes below, so people have access to find them and you.
Awesome. Thank you so much, Erica. I really appreciate your time and reaching out. And I love always connecting with people that are in like supporting the same population, but like we all do it in different ways, which is awesome.
Yeah, I think it's just like the circle of life, like being able to support women kind of in all stages of motherhood and life in different capacities. So whether that's movements, and, movement related to health, not only like chiropractic, but just like health from the inside out. So many different facets and different areas that we can cover. But I'm so grateful that people like you exist so we can support women, and so we can just minimize those aches and pains and also have like preventative care too. So
less interventions at births, and just like having greater lives.
Well, I'm going to end this recording, and thanks so much, Katie, Dr. Katie.
Yeah, thank you.